This episode of Us and Them was first released in December of 2022. Since then, it has received a regional Edward R. Murrow Award from the Radio Television Digital News Association for Best Podcast. We've updated this episode and want to share it with you again now.
All rise.
This is Kanawha County Juvenile Drug Court in Charleston, West Virginia.
How was your week?
That was going good.
Well, tell me what's good about it.
The kids here, all under 18, have been using drugs. For many of them, it's marijuana. But most of them are here because of another crime as well. That could be as serious as grand larceny or as simple as truancy, missing school repeatedly.
We want to keep you in the community. We want to keep you with your mom. But we have got to get you going to school.
Judge Joanna Tabbitt has been at the helm of this drug court for 5 years. She jokes with a lot of the kids, and you can tell she's bonded with many of them.
What is it that motivates you to smoke? When do you want to smoke?
Just bored, I guess.
You just get bored? We got to find some things to occupy your time.
Sometimes she even sings.
Say, I was born a coal miner's daughter.
She can also be harsh.
It is unacceptable to me, unacceptable that you don't get out of bed to go to school.
Tabbitt says she wants to help these kids create a better life. She delivers a stern message to a teen girl who's tested positive for meth use. The girl is still denying that she's used.
I'm going to tell you something. We're going to continue to work with you. Okay? I want to continue to work with you. But I am really worried about you. I'm very worried about you. Because I think you are, well, I know you are using, and these are serious substances. Serious substances. They'll get you wired. They'll get you to the point where you're not eating, not taking care of yourself, and you don't want to be doing that. I mean, you're 15 years old. Yeah. So, we're going to continue.
Drug use is a public health crisis in West Virginia, as it is all across the country. And the COVID-19 pandemic only made things worse. Overdose deaths increased, and isolation hit people with addictions hard when they couldn't access resources they needed. And as West Virginia continues to wrestle with these complex issues, there's a fair amount of consensus that we cannot incarcerate our way out of this problem. But how to solve it is another question entirely. From West Virginia Public Broadcasting and PRX, this is Us and Them, the show where we tell stories about the things that divide us. I'm Trey Kay. In this episode, we look at one tool that's being used across West Virginia and across the country to treat drug addiction within the criminal justice system.
Hey, good evening. I'm going to call Juvenile Drug Court into session.
Drug courts divert people away from incarceration and into a rigorous treatment program. The first drug court in the U.S. opened in 1974 in New York City, where strict drug laws created a wave of cases that overwhelmed the criminal justice system. Adult drug courts eventually led to juvenile drug courts, the first of which opened in 1995 in California. In West Virginia today, there are 28 adult drug courts and 17 juvenile drug courts.
I guess we're getting away from calling them necessarily drug courts and refer to them more as treatment courts. But what they are in an adult world and a juvenile world is they're diversion courts.
Judge Tabbitt says giving juvenile offenders options is essential.
There's a recognition that incarceration and placement for these kids in detention facilities is not the answer to this problem. And when we can work with adults, frankly, in the community, and when we can work with youth in the community, the outcomes regarding their treatment and their future and their ultimate success in the community are much greater.
Tabbitt and her team work with as many as 20 kids at any given time. and the numbers are going up. They all meet together once a week on Tuesdays and go before the judge to talk about their case in front of all of the other kids. Most kids are there because of crimes, some low level, some more serious, like domestic battery or breaking and entering. All of the kids are diagnosed with a substance abuse disorder. Most smoke marijuana. A few are testing positive for drugs like cocaine, meth, heroin, and fentanyl.
One of the most difficult things to do is to determine when someone's in front of you and accused of committing a lot of crimes. Is this an individual who is committing crime to fuel that addiction, or is this an individual that is frankly a criminal with a recreational drug habit? Because we see both.
Some of the kids have already been convicted, while others have been diverted and are on an improvement track.
Here's what we're going to do. We're going to divert you, and we're going to give you this opportunity to work this program.
In phase 1, the kids come to drug court every week. And if they get to phase 2, it's every other week. Phase 3, every 2 or 3 weeks. They're drug tested regularly, they have a strict curfew, and they need to keep going to school. They do community service. Theoretically, they can complete drug court in 7 to 8 months.
And that's if everything rolls perfectly and there aren't any relapses. But of course, relapse is part of recovery. We understand that.
The drug court treatment team includes a probation officer, a therapist, and educational resources. There's grant funding from the Greater Kanawha Valley Foundation to help kids and their families with more basic needs, like food and transportation. Us and Them also receive some funding from that foundation.
I understand. I can't get them to sobriety in these self-actualization needs if they are struggling with fundamental needs and they're worried about getting their utilities paid, getting their rent paid, things like that, not having transportation. And we are able to use these monies for those purposes and have helped families that way.
And while Tabbitt says drug court is a gentler approach than a regular criminal proceeding, she makes sure the kids know this is serious.
It's formal. I mean, I take the bench. I'm robed. They need to know that, but I also want to be able to engage with them in a way they may not feel comfortable engaging with me in open court. And frankly, they do. So it works.
Can you give me an example of maybe how that would be?
Yeah. It's tough to give you an example. Maybe I'll invite you to come and watch sometime.
I took Judge Tabbitt up on that. And in the fall of 2022, I sat in on juvenile drug court. And it was evident right away that this is not your average criminal proceeding.
Night with friends.
When a participant is doing well, for instance, if they pass their drug screen, they get to spin what's called a wheel of incentives.
Night with friends.
Yeah.
Oh, that's a good one.
But Tabbitt is a judge, and there are penalties. Here she's talking with a young man who recently broke curfew.
But what we're going to do is, because that curfew situation, we're going to whack your curfew to 6. From 7 to 6, okay?
Yes, ma'am.
So you got to be home at 6 o'clock.
There is no one-size-fits-all approach with these kids. Some of them relapse, and Tabbitt gives them another chance. Like this young man who tested positive for marijuana. Judge Tabbitt said she appreciated that he was honest about it.
I won't take this as a bump in the road, because relapse is part of recovery, and you had a slip up, but we got to get it corrected.
Or that 15-year-old who's using meth, she still won't admit it. But the drug tests are clear.
Nobody here wants to kick you to the curb. Everybody here wants to help you, but we can't do it if you don't help yourself and commit to it.
Others break the rules, and Judge Tabbitt dismisses them. That's what happened to one young man when I was in drug court. He got caught smoking pot, and he had several incidents in a row that week.
Well, what happened Friday night?
I snuck out.
You snuck out. What time?
Like 10 to 1.
10 to 1.
He also got caught with a marijuana vape pen twice, and he was hanging out with another kid who was on probation. and that's prohibited.
I don't like to do this, but I just don't think that you are benefiting from what it is that we are doing in drug court. And I know you were told by Judge Salango that drug court was your last opportunity to get it together. But I do think that you self-sabotaged for whatever reason. I don't know why that you did. But we are going to dismiss you from drug court. And consequentially, do you have an understanding of what will happen now?
Listen.
What's going to happen?
I gotta go see my actual judge, and she'll send me off to a
Now
placement.
that's going to be her decision.
A placement is detention in a locked facility.
But if she has told you that, my guess is that's what's going to happen. And trust me, nobody here in this room wanted to do this today. But we do feel it's the best thing for you.
In Kanawha County Juvenile Drug Court, most of the kids do not make it through successfully. The graduation rate for the past 2 years was 17%. That's lower than the average across West Virginia for those 2 years, 37%. And a survey of treatment courts across the U.S. found a juvenile graduation rate of 62% in 2019. Judge Tabbitt says while statistics are one measure of evaluation, she tries not to get overly concerned with numbers. While her team gives the kids every opportunity they can, Tabbitt says they will not graduate them just to graduate them. Of the kids who made it through Tabbitt's drug court over the last 2 years, just under 18% have faced new charges since they graduated. That's according to the state's probation database. But even for those who don't graduate, getting kicked out of drug court isn't the end of the story. Tabbitt tells this young man he can come back and see her anytime.
Our door's always open, okay?
And Tabbitt isn't kidding. 2 weeks later in drug court, she welcomes back another kid who did not make it through.
Would you come up, sir? You were in a drug court for a while, right? A couple times. Gosh, was it about a year ago? Things weren't working out so well.
Yeah, about a year ago.
And
He failed the drug court program and was sent to a locked facility. Then he was assigned to another placement. And at that second one, it's called Tiger Morton, something clicked. Tabbitt asks him what made the difference.
I just got tired of doing the same old thing. I wanted better.
and what happened while you were at Tiger Morton?
I had an epiphany, I guess. I don't know.
And what did you get today?
It's an education certificate that's similar to a GED.
Actually, I got a copy just for you, so you could either frame it up and put it on your fridge. That's a copy just for you. I have another one at home. That one's for you.
Now, in front of all the other kids, Judge Tabbitt does something you won't often see in a regular courtroom. She hugs him.
We went round and round a lot, didn't we?
Yes, ma'am.
And that's why I wanted to come off this bench, because I wanted to tell you personally, eye to eye, how super proud I am of what you've done, and how I know it wasn't easy, and how I want you to build on the successes that you've started. And everybody here, I think, is incredibly proud of you and the work that you've done. A big round of applause.
There's an irony behind the nation's drug court efforts. Many states across the country use diversion programs while marijuana, at least, is being decriminalized. Kids face the possibility of lockup if they don't stop smoking pot. But Judge Tabbitt says it's not for her to comment on the morality of the law.
The kids want to raise that issue all the time, but what I tell them is a couple things. Irrespective of that, it is illegal here in West Virginia, and it is illegal everywhere for you to be doing this under the age of 18. And you're under 18, and you're on probation, and you need to be following terms and conditions of your probation and court orders.
Judge Tabbitt takes on her drug court duties outside of her regular hours. She's not required to do it. She doesn't get paid more to do it.
This is my favorite part of my job. It's my favorite part of what I do, is work with youth and working in the treatment courts. And I'm committed to it. I can tell you unequivocally that 70 to 80% of the cases that we have in our courts deal with some aspect of drug abuse, if not more. And it's important, and it's significant. It's a problem, and it's a way I think that we, as judicial officers, can make a difference.
Not every judge wants to participate in a drug court. And so obviously people who engage with drug courts and who participate on a drug court team are there because they want to and they want to help and they believe it works.
While Judge Tabbitt and many others believe in the transformational power of drug courts, there are some who are not convinced.
My name is Sheila Vicaria. I'm the Deputy Director of the Department of Research and Academic Engagement at the Drug Policy Alliance. We are the leading national advocacy organization here in the United States working to end the war on drugs.
Vicaria worked at an outpatient treatment center in upstate New York from 2005 to 2007. She was getting her master's in social work, and she was new to the field. She also served as the treatment center's representative in the county drug court, but she didn't stay in that job long.
I couldn't even make it a year, and let me tell you why. Hardly anyone that I ever did an intake assessment on ever made it to my aftercare groups. And to me, that was such a clear indicator that there was something wrong in what we were doing.
She believed many of her clients just needed a few more chances. The program's format felt too rigid, too punitive.
Watching someone urinate in a cup and then testing them in front of them and then expecting them to open up their hearts in treatment and to be open about their struggles when I was also like de facto the cops. I was policing them, I was monitoring them, and I was the deliverer of punitive consequences myself.
Vicaria went from there to working as a mental health provider at a needle exchange in New York City. When she was no longer drug testing people or imposing sanctions, she found she was able to have more honest conversations.
I wanted to understand their drug use. So tell me what it is about what was happening this weekend that led you to use crack. You know, if people were telling me about their heroin use, I would also ask, did you make sure not to use alone? Were you mixing with other drugs? Was someone there to administer Narcan if you needed help?
Vicaria says one key difference was that abstinence was not necessarily the end goal. Instead, the clients set their own goals.
I worked with many clients towards abstinence over the course of working with them at the needle exchange, but I'll tell you that one of the best strategies for achieving abstinence was them getting housed. My challenges with drug courts are not personal to any individual in it, but are a critique of it as a response to some of the structural failures and challenges that currently exist in our treatment system, but also in our criminal legal system. In a system where drug users themselves are disproportionately targeted by our criminal legal system, sure, the idea that giving them access to treatment in lieu of having to go into jail seems like a great option because it's a broken system.
Vicaria has several specific criticisms for drug courts. She says because they're so limited in their scope, they have to cherry-pick their participants.
This is not a widespread solution to a huge problem. This is a solution for a small subset of people. So then the first question has to be, why is it that some people get access and some people don't?
Vicaria says many drug courts only take first-time offenders, and they don't take violent offenders or sex offenders.
Drug courts also do not often want people who have co-occurring mental illness or who may have too many other comorbidities. And so they also leave out sometimes the most vulnerable people.
Drug courts often require a guilty plea before someone can participate. Vicaria says that limits their options afterward if they don't make it through the program.
So if you are one of those people who started drug court in good faith thinking you were going to make it, here you are now stuck having pled guilty to a charge, and now you might have to serve out the rest of your term inside, when maybe if instead of choosing drug court, you could have actually pled out for a shorter time and just served your time and left.
Some critics say people should participate in drug court programs before they plead guilty. That way, if they don't succeed, they can still go back to the bargaining table to work out a new plea deal. Vicaria also has a problem with what she calls the carrot and stick approach in drug court, and the use of incarceration, for example, a weekend in jail, as a sanction.
We know that incarceration in and of itself is a humiliating, traumatizing experience, and the use of this as a sanction in a court that's supposedly therapeutic is also questionable. I do not believe that children should ever be threatened with jail or prison. I do not believe that any child should ever be in jail or prison for any reason.
We asked Judge Tabbitt about many of these criticisms. She has sanctioned 2 kids with weekend juvenile detention. She says it was a last-ditch effort to show them what lockup would be like before she sent them there. Juvenile participants in Tabbitt's court do not have to plead guilty to be admitted, and she does take kids with co-occurring mental illness. But she acknowledged there's a certain point where they need more intensive care than Kanawha County's program can provide. There's a broader criticism of drug courts and our nation's response to the opioid epidemic as a whole. It focuses on our fraught history with drugs and systemic racism. It's no secret that the public health approach we're taking to opioids, which have hit white people hard, is dramatically different from the war we waged on drugs when the crack epidemic devastated mostly black communities.
In the 80s and in the 90s, communities of color in the inner cities were calling out for help. They were calling out for support. They knew that their communities need help. And what did they get? They got a punitive harm-inducing approach, an approach that involved crackdowns and militarization and policing in their neighborhoods and communities, and the sweeping up of young people and family members when they could have been offered opportunities for help and support.
In 2015, a story came out in the New York Times with the headline Vicaria says she'll never forget. In heroin crisis, white families seek gentler war on drugs.
Families were calling for help and they said, hold on a second. I know that you used that solution in your playbook before, but we do not want any part of that. Can you take a gentler approach?
Drug courts may be part of that gentler approach, but to Vicaria, there's still another arm of a larger system that's broken.
The problem is the system, and the drug courts are one pathway, supposedly, for some people to kind of navigate it, but it's not readily available or accessible, and it also doesn't challenge the existing system. It doesn't actually create change for anyone else.
When we come back, we'll visit an adult drug court in Huntington, West Virginia, a town that once made national headlines as a hotspot in the opioid epidemic.
We had so many overdoses and a number of deaths and so forth that really put the spotlight on it.
Were you hopeless before? Or?
I guess I had my hopeless moments, yeah.
And all of a sudden, I thought, you know what? There's got to be a better way.
And we'll dive into the data on drug courts to try to answer the question, do they work?
So they like their numbers, and they think that they save money by doing this.
You're listening to Us and Them. This show is supported in part by the West Virginia Humanities Council, the Greater Kanawha Valley Foundation, the CRC Foundation, and the Daywood Foundation. This episode is supported with a grant from the Just Trust.
Music lifts us up and brings us together, even when we can't get together in person. Mountain Stage brings you live performances on the air, online, and in our podcast. They remind you how it feels to be in a live audience listening to live music. This is Larry Gross, host of Mountain Stage. Find a link to our stations and our podcast online at mountainstage.org.
I have not used since July 9th of 2021. I've been trying to do different rehabs, but I was doing it for all the wrong people. I was just doing it to make the judge happy, to make my probation officer happy. It's just this time I did it for myself.
Can you say, was there a moment when something clicked for you? Were you?
Yeah, I overdosed. I had to learn how to walk and talk again, and from that moment on, I just knew that there's more to life than death.
Hey, it's Trey, and this is Us and Them from PRX and West Virginia Public Broadcasting. Adam Fowler graduated this fall from adult drug court in Cabell County, West Virginia.
It feels so good. Like, I remember when I first started this program and I would see these other graduates graduate, and I would just look and I'd be like, I always said, I was like, man, I'm going to be that guy one of these days, and here I am, I was that guy.
At the Cabell County Courthouse in Huntington, you can see some of the progress they've made in the fight against opioid addiction through widespread cross-community collaboration. But 6 years ago, reporters came to town for a very different reason.
Burger King, Station 3, Station 3210 Washington Boulevard for an overdose.
This is an episode of PBS NewsHour from 2017.
It's not even 10:30 in the morning in Huntington, West Virginia, and it's happened again. Another overdose, this time just outside a fast food restaurant.
Well, I think it was really bad back in 2016 when we really started to get a lot of that national attention.
Officials say there have been more than 100 deaths in Cabell County so far in 2017, with more than 2,000 overdoses expected by year's end.
We had so many overdoses and a number of deaths and so forth that really put the spotlight on it.
Judge Gregory Howard is Chief Circuit Judge in Cabell County, and he oversees the adult drug court.
There probably wasn't a family in the area that wasn't touched or affected in some way, either a close family member or distant family member or a close friend, somebody who had fallen into, drug usage, heroin, pills.
But today, Judge Howard says Huntington has become a hotspot not of overdoses, but of recovery.
Having the spotlight on this area was a major negative, and people felt a lot of pain through it, especially as we were going through it. But the end result of it has actually been a really good thing, I think, because we had so much attention here, so many resources were poured in, a lot of grant money, a lot of people who are committed to addiction and recovery, that the area has really blossomed into having so many great resources for people who are suffering from addiction.
One of those resources is adult drug court. It's a whole lot different from juvenile drug court. For starters, it's full-time.
We basically take their lives and we completely put it on hold. In other words, they're not allowed to work a job. We have control of basically every hour of their day for the first phase of the program, which is 16 weeks.
That first, most intensive phase is where the highest number of people drop out. Participants are on GPS monitors, at least at the beginning, and they're often set up in housing programs. They're drug tested regularly. The average amount of time in the program is 21 months. The participants are anywhere from 20 years old to their 50s. And Howard says, contrary to Sheila Vicaria's criticism, these are not first-time offenders, and they're not there just because of drug use.
There's nobody in our drug court who's there because of marijuana. I can tell you that right off the bat. It's all heroin and meth, almost exclusively those two drugs. We're talking about people who have already been in using illegal substances for over a decade. And so they have a serious problem. And they're there in drug court for multiple reasons. It may be because they have a bag of meth on them, or because they're out committing property crimes because of the drugs.
Everyone who enters this drug court has been charged with a crime, and they do have to enter a guilty plea. But Judge Howard explains that often that plea is conditional. If the person successfully completes drug court, the felony is wiped away, and they can plead guilty to a misdemeanor instead. And admission to drug court is never a requirement. Participants have to apply.
The program is for people who are on their way to prison. These are people who are simply committing crimes because there are receptors in their brains that need that opioid bond. And so we're trying to break that.
And the critics of drug court believe that for the people who have a problem with dependence, that treatment and support should be available without the threat of jail or prison time. What do you think of that?
I just don't think it's practical. I don't. People that have that mentality, I don't think truly understand the criminal justice system and how it merges with addiction. We're all about people having autonomy and privacy and freedom as much as possible within the program, but they do have to have accountability.
Howard has been overseeing drug courts since 2017. He says he's seen it work. And over the years, he's seen a trend. Participants are more committed and stay sober longer. According to data from the West Virginia Supreme Court over the past 2 years, more than 67% of Cabell County adult drug court participants graduated. Of those graduates, just over 10% have been charged with a serious crime since they finished drug court.
Do we have failures? Of course. I mean, we have fantastic successes and we have spectacular failures as well. Occasionally, we have someone who will OD and die while in the program. And then we also have a number of people who will go through a lot of relapses. And some of those people end up having to get kicked out of the program. We hate to do it. We try not to do it, but sometimes we're left with no choice.
Howard says he rarely kicks someone out for relapse alone. It's usually based more on behavioral issues.
When that happens, they have to go back to prison, and then that's kind of like just a reset. They start over. But drug court truly is a court of second chances. You know, most of these people have an underlying problem as to why they turn to drugs in the first place. And then they get in a system, they're used to the criminal system where they're constantly looked down on and punished, and then they get into this program and they realize, hey, these people care about me, you know? They want to see me succeed. This is the first time anybody's ever looked at me and said, we want you to succeed.
Based on the graduation rate, Judge Howard's court is pretty successful. 67% is higher than the national average. A survey of thousands of treatment courts across the U.S. found the average graduation rate in 2019 was just under 60%. That's a lot of graduates nationwide. But it also means that more than 40% of participants fail. Some studies put that rate at more like 50%.
I'm wondering, what does it mean to fail at drug treatment? Does not treatment fail you? But indeed, you can fail at treatment.
Trey Kay is one of the scholars who's looked into just how effective drug courts are. He's a professor at Wesleyan University in Connecticut, and he wrote a book called Enforcing Freedom about drug treatment courts in the U.S. How do we as a society measure the success of drug courts, and how much do we know about how successful they are?
So the criminal justice system, unsurprisingly, measures recidivism. That's their measure of success. Their second measure of success is how much money are we spending as a criminal justice system? Are we saving money by doing it this way versus just locking people up? So they like their numbers, and they think that they save money by doing this.
In 2012, researchers analyzed more than 150 existing studies on drug courts. They found that juvenile drug courts have a relatively small impact on recidivism. In adult drug courts, though, average recidivism dropped from 50% to 38%. That's a pretty significant improvement, enough to make the researchers recommend continued funding of drug courts. An evaluation of several drug courts by the National Institute of Justice estimated the program saved about $5,000 to $6,000 per person. But Trey Kay thinks the apparent cost saving is less straightforward than it appears.
When you fail at treatment, you get sentenced to prison. And the thing about most drug courts is most of them are organized in such a way that you've had to plead guilty in order to participate in the drug court program. So you've pled guilty to the most serious charge that the district attorney's office was able to levy against you. You've lost your opportunity to do a plea bargain. Now you've spent, a year or however long or more going through the drug court system, and now you're going to be sentenced to prison for an even longer time than if you had just done a plea bargain at the beginning. So in other words, what the drug court does is it takes half the people that are going through its program and it actually intensifies the war on drugs. And the half that fail, maybe not surprisingly, are disproportionately black, disproportionately poor. The people who most need relief in the war on drugs are most punished by the drug court system.
When we look at the cost for people who fail drug court and spend a longer time under criminal justice supervision, is there still any money saved? Trey Kay isn't so sure.
Typically, when they do their cost-benefit analyses, they don't look at, wow, well, we have 50% of the people who are going to prison for longer than they would have. That's actually an added cost. So it's not clear to me that they actually are saving money or overall reducing recidivism.
Trey Kay is not the only person who thinks we need more data on the subject. The researchers who performed that big analysis had some harsh words on the pool of studies they had to draw from. They say despite the popularity of drug courts, their effectiveness in reducing recidivism remains ambiguous. And we don't have enough information on which aspects of drug courts are actually helpful. They say much of the research on drug courts is methodologically weak and call for more studies. And the U.S. Government Accountability Office has weighed in on this as well.
They've been very critical of the data, and they've suggested a number of ways that data needs to be improved.
Kay says he's not surprised that drug courts bring down recidivism rates because they connect people to treatment. But he says it's still not clear that they perform any better than just offering treatment alone, without the specter of arrest or prison time.
What drug courts do is they offer this rationale by making the criminal justice system look like, oh, this is a service. It's a positive thing when we arrest people. That's how they get services that they would otherwise never receive.
Critics warn that this mentality is actually widening the net and causing officers to arrest more people for low-level drug crimes.
You're doing something that's supposed to be beneficial, but you're actually simultaneously expanding the reach of the criminal justice system into especially young people's lives.
It's clear that we need more data. But at the end of the day, the numbers only tell part of the story.
It's a way of measuring success in terms of cost to the government. And what it doesn't really do is answer the question of, like, how beneficial are these things to the people going through the programs? How do they see these programs?
Drug courts can be a less punitive option for people who have already been arrested and charged with a crime. But Kay thinks our focus should be on offering those people services before they ever commit those crimes.
A public health approach to the issue of drug use would be, I think, a very proactive one. It's not an excuse to just abandon people and just say, okay, we're not going to arrest you and we're not going to do anything for you. Why do people need to get arrested to get job training? Why do people need to get arrested in order to get help getting their GED? Those are programs that should just be available. You know, I'm not naive and don't think that everyone is going to take you up on those services. You're going to have problems with the public health model. But I would rather have those problems than the problems with the criminal justice system that just is inherently destroying people's lives. You go through a prison system, it's very challenging to get your life back together again.
But I just want to be clear, is there a problem with access to drug treatment for people who haven't gotten arrested?
Absolutely. There are huge waiting lists. It's very hard to access. A lot of people on the street, they don't have their Medicaid card ready to go. They don't have all their paperwork in order necessarily. One of the first things that the drug court does is it helps people get their paperwork in order so that the court doesn't have to pay for the treatment.
So it's an accelerator. I mean, it's like you committed a crime, and in many ways that kind of bumps you up to the top of the line.
The state has a perverse incentive to abandon people unless they're causing other types of problems, like committing crimes, for example. People should not be abandoned simply because they're merely drug users and they're not committing other types of more serious crimes.
And when you say you're not naive as to how society works, I mean, to me, when you suggest, why don't we take away the hammer being the arrest, it seems like our society would say, hey, wait a minute, that's not going to work. We can't take away the hammer.
That is a challenge of our society, that we have a society that has a strong punitive orientation. But that's the challenge, is to really show people that another approach is possible and can be effective.
Trey Kay acknowledges that for some people, drug court is a lifesaver.
There are many people who go through the drug court program who are enormously grateful for the help that they receive. I had people say, thank God I was arrested. But to me, that's not necessarily, some people go to prison and they have life-transforming things happen to them there, and they come out a changed person, and they're like, thank God I was arrested, and thank God I went to prison. That doesn't necessarily mean prison is a good policy option. The fact that some people are able to make use of it.
Regardless of the policy debate, I met some people who were grateful that they went through the Cabell County Adult Drug Court Program.
Do we have all 4 graduates here? Raise your hand if you graduated.
It's graduation day for Judge Gregory Howard's drug court. They have these ceremonies 4 or 5 times a year.
Thank you guys for being here today. This is one of our great celebrations in Cabell County Drug Court.
Today, there are 4 people graduating, including Adam Fowler. You heard him earlier. His probation officer shares a bit about his journey with the court.
This man, before we got him, was dead in the hospital bed, in a coma, okay? And he did it. He overcame it. To come from where you came from to where you are today is nothing short of a miracle. You did it. You know, it's on you. And I couldn't be more proud of you, so good job.
I'm not very good at talking in front of people, but I want to say thank you to the drug court team, just everybody in this program.
There are other participants watching the graduation. Some of them are in their first week. Judge Howard wants this to be an inspiration for them.
Anybody that thinks that drug court doesn't work, just look at these graduates and tell me that to my face, because I don't buy it. If you're willing to put the time in, you will be a success like these people.
I caught up with Adam Fowler after the ceremony.
So, how long had you been using drugs?
The last 15 years.
How old were you when you first started?
Probably 14. Actually, it'd be longer than that. It'd been 16 years.
How old are you now?
31.
How are things different now that you've been through this process?
I want to live life today. That's just what I want.
How's that different from before?
I don't know.
You didn't want to live life?
I mean, I did, but I didn't want to do it without drugs. Yeah. I guess, I don't know.
Were you hopeless before, or?
I guess I had my hopeless moments, yeah.
I want to hear, what happened with the overdose, and you said you had to learn to walk and talk again. I mean, what happened?
Just heroin. Heroin just almost ruined my life. I did too much, and it just put me in a very bad state.
Were you in a coma?
I was on life support for 33 days. 32, 33 days or something like that.
On balance, the whole experience, was drug court a positive or a negative?
It was a positive thing, for sure. Like, it was definitely a lot of hard work, but everything about it, looking back, man, it was nothing. It did nothing but help me.
There's another person at this graduation who knows this process intimately.
My mom is an addict. She was one of the first people who I started using with. And as a child, we don't ever think that our parents are going to steer us in the wrong direction. But sometimes people make a choice. Some people, eventually it does become a choice. Some people are born into it.
Robin Sullivan works as a support specialist with people in this very drug court. But in 2019, she was the one graduating.
Started off with marijuana, then I started drinking, and then it was any kind of, Xanaxes, Klonopins, any kind of pill, and then it went from that to heroin, when all of, we were flooded with the opioids, Oxycontin, Roxycontin, those, then, methamphetamine hit the scene, and I tried that. I would do anything that was put in front of me to make me, not deal with reality.
And how old were you when you started using?
13.
How did you feel about having the threat of prison kind of hanging over you in the drug court process?
I think at first it was like, oh man, I'm going to go to prison if I don't do this. But then what happened is we're in Huntington, overdose capital, and my friends were dying. So death became my reality. If I didn't do this, it wasn't about prison anymore. It was about, if you don't do this and what it's teaching you, you're going to get out of here and you're going to die. I could have made it in prison. I'd been fine. And then I would have got out of prison and I would have not learned one thing, and I would have continued using, and I would be dead. We probably wouldn't be sitting here talking right now. When I say death, I'm talking about not just physical, but there is spiritual death, and there is like to where you're just a shell of a person just walking around. So, those concepts to me became like, I do not want to die, so I have to do this.
You said that your mother used drugs, and she was one of the first persons that you used with. What's she doing today?
She's actually she is going through liver failure and kidney failure, and she's doing her best to stay sober right now.
Since we did this interview, Sullivan told us her mother is now in a nursing facility and is not expected to survive. But she's lived long enough to celebrate the birth of another grandson. Robin Sullivan recently gave birth to a baby boy who she says was born into a healthy, calm, and loving environment. Sullivan says she hasn't used drugs since July 17th, 2018. So she says, unlike her teenage son, this child will never have to see his mother high. The people we talked to for this episode don't all agree about the effectiveness of drug courts or how they should be used. But they do agree on one thing. Drug courts are just one tool among many to address a complex issue. There are no easy answers.
I'll be honest with you, for years, I didn't know how to react to people that I was dealing with.
Jan Rader leads the Mayor's Council for Public Health and Drug Control Policy. But at the height of the opioid crisis here in Huntington, she was the fire chief. She responded to more overdoses than she cares to remember.
And all of a sudden, I thought, you know what, there's got to be a better way. And I started talking to my patients.
Rader would stay on the scene, talking with people who had just overdosed and their families.
It's interesting what you learn about people and their background and how they got to where they are. And I would ask questions. How did you get here? What started you down this road? I'm not trying to judge you. I'm curious, and I want to understand and be able to help you better. And I think those conversations need to happen on a more regular basis.
Rader was pulled into the center of a collaborative effort to stem the tide of drug overdoses. It transcended departments, cultures, and even opinions.
And that was in the fall of 2014.
The mayor put together an Office of Drug Control Policy. He paired Rader with a retired police chief and a crime analyst from the Huntington Police Department.
So he put us together, and we started doing our research and putting together data, and then we started meeting with very small groups here and there, and we started educating and reaching out and getting people out of their silos.
What has made things better?
Uncommon compassion, an ability to work together with other entities to try to figure things out. We as a city work very well with our hospital systems, with our providers in the area, and it takes a community. It's not any one person. We can't solve this ourselves. It's a community that comes together to work on something, and that's what makes us unique. We will check our egos at the door, and we will roll up our sleeves, and we will all pitch in.
Many people who work in this field are hopeful that settlement money from opioid lawsuits will continue to strengthen the response to addiction. The state of West Virginia has received about $1 billion from drug manufacturers and distributors. The state attorney general says that money will go toward fighting the opioid epidemic. While these settlements may be good for West Virginia, the public health crisis from opioids is far from over. The CDC says opioid deaths have gone up 60% nationwide since 2020. And synthetic opioid deaths have nearly doubled. You've been listening to Us and Them. Our team for this show was me, Trey Kay, Emily Havik, and Kate Smith. West Virginia Public Broadcasting's Curtis Tate recorded some of our interviews. Special thanks to the folks at Kanawha County Juvenile Drug Court, Cabell County Drug Court, the West Virginia State Supreme Court, Nick Lefwich, Dave Lucas, and to the people who shared their stories with us. Michael Lipton, Tristam Lozow, and Ahmad Solomon wrote and performed the Us and Them show music. Mark Lerner designed our logo. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, the Greater Kanawha Valley Foundation, the CRC Foundation, and the Daywood Foundation. This episode is supported with a grant from the Just Trust. You know, we'd love to hear your thoughts about this episode. Would you share them with us on our Facebook page or Twitter at @UsThemPodcast? Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them. This episode of Us and Them was first released in December of 2022.
Support for this podcast comes from the Corporation for Public Broadcasting.